Hello everyone, I'm Tori, and we're going to be going over Moses Sinclair VR. So today we have Mr. Moses Sinclair. He is a 68-year-old male who presents to the clinic today with right arm weakness and pain. He stated that when he goes to grab things, they keep dropping because he can't hold on to them, but it's only in his right hand. He states that this pain started about 3 months ago, and it gets increasingly worse every day. He does get relief at nighttime when he rubs his arm and rests, or during the daytime when he takes extra strength Tylenol. Currently rates his pain 4 out of 10 and states he has received no treatment or seen no provider for this yet. Moses does not take any prescribed medications. The only medications he does take is the over-the-counter Tylenol, and he usually takes 2 tabs every 4 hours when he needs it. Moses has no allergies. Regarding medications, he did say that he is sensitive to ibuprofen and Advil, and they give him a stomach ache. Moses does not have any significant past medical history. He's never had any chronic illnesses or traumas and never been hospitalized or had surgeries. Asking about his family history, both parents are still alive and well. His mom did have a CVA 10 years ago, and his dad is a type 2 diabetic. Mr. Moses, he does have a high school diploma and has been a tailor for 30 years. He does have a wonderful wife of 28 years that he resides with, and does state that he feels safe returning home. He denies any tobacco, alcohol, or recreational drugs. He does state that he has 1 glass of wine with dinner, but that is it. Upon reviewing Moses' review of systems, he denies most questions that were asked. The only issue that was addressed was the pain in his hands. Objectively, Moses weighs 195 pounds. He is 5'9", and his BMI is 28.8. Vital signs are normal today, as they were checked in the office. He is very healthy, appearing in minimal distress and pain. He is alert-oriented, answers everything appropriately. Hygiene is intact. Dressed appropriately, good clothes are in great condition. Upon his musculoskeletal assessment, there are no deformities or abnormal findings. There is pain noted in the right wrist. Upon testing a Phelan's test and a Tinel test, they are both positive with pain in the right hand. Cervical spine, palpation and range of motion. There are no neck and back deformities. No signs of any changes or trauma. Posture and gait is upright and smooth, steady, and within normal limits. There's no discomfort with flexion, extension, side-to-side rotation of the cervical spine, and there's full range of motion. Lab tests that I have considered ordering for Moses would be a PSA, because he has not had that checked, and it was normal. And then also an A1C, because his family, his dad does have diabetes, so it would be appropriate to check him, and his A1C was normal. My final diagnosis was carpal tunnel syndrome. He originally came in today with complaints of right-sided pain and weakness, which a common symptom of carpal tunnel syndrome is numbness and tingling and pain in the hand and forearm. And our exam was positive for those. 2 different differentials. One was cervical radiculopathy, and that is caused by radiating pain, weakness, or numbness due to any nerve being pinched in your neck. So that pain would go from neck all the way down to your hand. And with Moses, our pain is only noted in our hand, so that is less likely. The second differential was the de Quervain vein tenosynovitis. That is where there is swelling in the tendons that run along the thumb side of your wrist. And with Moses, it was his whole hand and the palm. And with the de Quervain, it is just on the thumb side. So that is less likely than carpal tunnel syndrome. So our plan of treatment for Moses, one would be medications, which would be NSAIDs, ibuprofen or naproxen, and then possibly steroid injection if unrelieved by those medications. Some non-pharmacological recommendations would be rest. I know he is a tailor and he has lots to do, but rest would be very important to his healing. And then a wrist splint. We advise him to wear the splint during activities that could exacerbate his symptoms, such as his current job as a tailor. This splint will help keep the wrist in a neutral position and reduce that pressure on the nerve. Patient education, we can talk about weight loss. His BMI was a little elevated. And then educate him on carpal tunnel, signs and symptoms, treatments, and how to use a splint. Health promotion, we talk about activity modifications to avoid repetitive movements or activities that worsen his pain, and encourage frequent breaks. And then also hand and wrist exercises that would help strengthen that. So some referrals would be to a hand specialist or a surgeon. If this continues to get worse, he can see them. Or physical therapy. They will help in strength, muscles, and work on increasing flexibility within the hand. And then we would recommend Moses to follow up as needed for treatments. Thank you.